Just last night, as part of our team investigation on opioid overdoses, we introduced you to people prescribed opioids who spiraled into addiction. Then the tragedy it left behind and the loved ones desperately working to save others.
We know fatal overdoses involving opioids are continuing to rise, with fentanyl mostly to blame for deaths. But it's important to remember the first wave of the opioid epidemic was prescription pain kills.
So tonight, I-Team investigator Kylie McGivern continues our in-depth coverage with an update on new changes prescribing guidelines. Kylie?
Well, at the end of last year, the CDC released new opioid prescribing guidelines, loosening the restrictions it put in place back in 2016, giving doctors more leeway. This prompted backlash from Florida's Deputy Secretary for Health. Dr. Kenneth Shepke criticized the updated guidance, which eliminated 2016 recommendations limiting opioid treatment to 3 days, and that doctors avoid increasing dosage past 90 milligrams of morphine a day. He took aim at the CDC's new report, which says opioids carry considerable potential risk. Shepke wrote, "There is nothing potential about it, and they are not essential for pain management."
It is very confusing, I think, for those who are the patients, physicians, the whole entire medical establishment to try to figure out what is the best way forward.
Troy Quast, a professor with the USF College of Public Health, has looked at the relationship between opioid prescribing rates and children going into foster care.
There's very stark findings, especially for Florida. Our initial paper looked at from 2012 to 2015 and found that a typical increase in the prescription rate of opioids was correlated with a roughly 30% increase in the removal rate of children from their homes.
Quast acknowledged the crackdown on prescribing practices likely pushed more people to drugs like heroin and fentanyl. Still, Quast worries about the potential impact of the new guidelines.
We're going back to where we were to some extent. We got to this point because of the overprescription due to trying to treat pain to some extent. Are we potentially opening that door again? And it does give me some pause.
And we will continue our coverage on this topic next week as we go with the Pasco Sheriff's Office's Behavioral Health Intervention Team as they passed out Narcan to the community in a fight to keep more people from dying from fentanyl overdoses.
It's getting out of control, absolutely out of control.